Good morning. We are not waiting for anybody. I'm looking here by 9 dots. So yesterday we concluded with we just did a general dosing, mentioning the use of the age, body weight, and body surface area. And I said that today we go deep, a step deeper into the different rules or formula that's from where they calculated what we are using, what we use yesterday. So today we'll continue from the pediatric dosing. We are looking at another material. So with this material now, we'll get to see how to calculate the body surface area. At the same time, that is how to use the body surface area to calculate the dose. Then we also look at other formulas. We look at other formulas. So now we take a look at how to calculate dose using BSA, how to calculate the dose using age, and how to calculate the dose using body weights. Now, I told you something about Young's rule, Clark's rule. I said that Young's rule focused only on the age of the child, the age of the child. The formula goes like this. The rule says that child dose, that is pediatric dose, is equal to weight of the child in pounds. Weight of the child in what? In pound, not in pound, over 150 times adult dose. That is, if you have if you are given a particular drug and the adult dose is known, and you are given only the child's age, and you are told to calculate the dose for the child, you use Young's what? Rule, which says that the child's dose is equal to age, weight, sorry. What did I say now? Which rule is that? Sorry. I am quoting class rule. Sorry, not Young. Clean it, please. This is class rule. Remember I said that class rule deals with what? Weight. While Young deals with what? Age. Please, I misplaced it. This I started with class rule, not Young's rule. Please, correct it. It's Young's rule that deals with the what? Weight. Can't you see that I put weight here? It's class rule, sorry, not Young. It's class rule that deals with what? With what? Weight, body weight. So class rule is what I wrote on the board, please. Class rule say that a child dose is equal to what? Weight of the child divided by what? Weight in pounds, not in kilogram. Divided by what? 150 times what? Adult dose. That is class rule. Now, Young's rule deals with what? Age alone. Young's rule said that the child dose or pediatric dose is equal to We are talking about Young's rule now. It's equal to child's age in years. Child's age in years. The age of the child in years all over, you put in bracket, all over the child's age plus 12. Or multiply by what? Adult dose. Young's rule said that child dose is equal to child's age in years over, you put in bracket, the child's age plus 12. Then multiply everything by the what? Adult age. Adult dose, sorry. Is it clear? This is Young's rule. The second one is class rule. I said before now that the class rule is preferred to what? Young's rule. Because it is more accurate to use a child's weight than just age. I think I mentioned it in our last class, right? So, unless maybe a calculation is specific, just maybe the question wanted to use Young's rule, but class rule is more accurate. I think I gave you instances whereby two children, one may be of the same age, but one may have more body weight, right? Yes. Another one may be malnourished or slim, or such. You cannot give them the same dose, because if you give them the same dose you give may not even do anything for the one that has weight. And if you consider only weight alone, and a lot of things are involved, that's also what led to when notice an issue, a deficiency, when you're dealing with weights, that what led to what? Using body surface what? Area. So you consider both the weight and the body surface area. In fact, the most accurate is what? Using the body surface what? Area, which I want to give you the formula now. So in a nutshell, you can say that class rule is a modification of what? Young's rule. Then using body surface area is also a modification of the what? Clark's what? Rule, because they consider the body surface area. Now look at the one with that has more body weight. The body surface area is of course, when it comes to a child that is plumpy, you also consider the body surface area. True of us. So you see that the age and weight alone are not what? Enough. There are this even that the height is also considered. The height is also considered. Two people may be of the same age. Apart from weight, two of you may be of the same age. Your height is far more than the other person's height. You see that the body surface area is also what? Considered. The size is also what? Considered. Not only the weight and the age. So BSA is a modification. In fact, that is the best way. Now I want to give the formula for how to use the BSA. So using BSA now, the dose is equal to the approximate dose for the patient is equal to BSA of the patient. The dose is what to what? BSA of the what? BSA of the patient, or simply BSA in what? Meter what? Squared. BSA meter squared over 1.72 meter squared. This 1.72 meter squared is average adult body surface area. This 1.72 meter squared is the approximate adult body surface. So approximate adult BSA. approximate adult what? BSA. Then, so the BSA of the patient in meter squared over 1.72 meters squared. 1.72 meters squared is approximate adult BSA. Then times what? Adult dose. This is the formula. If you want to calculate a child's dose, this is the formula you use. Considering the BSA. Am I completing? BSA, the dose for the child is equal to BSA of that child in meters squared over 1.72 meters squared. And I said that the 1.72 meters squared is the approximate adult what? BSA. Then times the adult what? Dose. So these are the three. Remember when we entered pediatric dosing, I said that there are three parameters that they consider: age, body weight, and BSA. So they are all factored in here. It all started from the age alone. That's what led to Young's rule. At the point, they realized that it's not enough. You need to consider the what? The body weight. That's how the body weight came in. Then after some time, that's where class rule came in. After some time, they realized that it's not even enough. You need to consider the body surface area of the patient. The height now came in. So this is the three formula. This will lead to this third formula for BSA. Am I communicating? Now, you know the adult dose, right? Of adult dose of a particular drug. You can trace that one easily. This one is constant. Average, approximate adult BSA is constant. How do you now get the BSA of the patient? How do you do it? How do you now know the BSA of that patient? How will you now do it? This will lead us to the use of nomogram. So we use nomogram to determine the what? The BSA. We use nomogram to determine the what? BSA. So I'll tell you how to use nomogram now. We'll do nomogram, how to use nomogram. After that, we enter drip rates. With drip rates, we are done. If you are done with drip rates, we are done with posology. We enter another topic, if time permits today. If not, tomorrow we'll continue. Now, let us now look at nomogram. Can somebody check? Go online. Just Google nomogram. Google nomogram. Go online. Google nomogram. And let's select the one that will give us what we want. Google nomogram. Post it in that our group. Google nomogram. Post it in that our group. It's a plot. Let me show you how it looks like, so that if you see it, you know. I'll tell you the principles first, then. So what is a nomogram? What is a nomogram? A nomogram is a table used to determine a patient's body surface area. A nomogram is a table used to determine a patient's body surface area. So to calculate a patient's body surface area, you should first of all know the patient's height, the patient's weight, either in pounds or kilogram. There are three lines here, three scales. One first scale, two second scale. The nomogram all contain about at least three scales: first scale, second scale, and third scale. Now, so to calculate the patient body surface, you need to know both the patient's weight, either in pounds or in kilogram. You also need to know the patient's height, either in centimeters or in what? Inches. So if you know these things now how do you now determine the patient's body surface area? What you do is this. You get a ruler, a metric rule that has a straight edge. Then you draw a straight line from the height of the patient to the weight of the patient on the nomogram. The line intersects at a point on the body surface area scale, which will indicate the patient's body surface area. Simple. I told you there are 3 scales. First scale, second scale, third scale. Am I communicating? Now, have you seen a nomogram? No, just let me see the one you got. Let me see if you can make use of it.
Only dictionary is showing.
See nomogram here. This image. This is a nomogram. See nomogram here. Let me look the one that befits what you are doing. This one is not clear. All right. This one is also not clear.
Maybe the problem is from.
Maybe
the problem is from a primary.
Is that primary you are using?
Yes, I can switch to Chrome so that I can see it.
Okay. I think this one is clear. It's clear here. It's clear. Now, a nomogram now, the first scale is what? Is it height or weight? This is height. This is the scale for what? Height. Is dual scaled. This side is inches. This side is what? Centimeter. One is centimeter, one is what? Inches. Then, the one in the middle, you can see two lines. 2 of them are both BS, are both surface area. But let me just write only one. You see surface what? Area. This is the second scale. Then the third scale is the what? Weight. Either in pounds or in kg. Now, see how to use nomogram. These things are scaled. Am I communicating? These things are scaled. Once you understand your measurement, you can trace it. Let's assume a child's weight is 20 kg. Let's assume, or 20 pounds, that case may be, or 10 pounds, that case may be. Now, we don't know where the person's surface area. This is just a scale of surface area. We don't know the one it will be. But we know the patient's, let's assume that the height is 60 centimeter, for example now. And you know the body weight to be 30 kg, for example. Let's assume this we are doing here is just assumption that here is 30 kg. Am I communicating? Let's assume that here is 30 kg. And let's assume that here is 60 what? Centimeter. Now, what you do is this. You get a ruler, a straight metric rule, cross it in such a way that it will cut off from this side, at the same time touch this place. You place it well so that it will touch this 60 cm and touch this 30 kilogram. At the point where it intersects with this surface area scale, at this point, let's assume here is 0.7. Let's assume, we don't know, or 0.2. Let's assume here is 0.2. Remember here is meter squared. Surface area is what? Meter squared. Let's assume it cuts at 0.2 meter squared. The body surface area of this patient is what? 0.2 meter what? Square. Am I communicating? Once you place it to you cut this place, any place it touches this surface area scale gives you the body surface area of that patient. You now get the body surface area of the patient and put it in that formula and divide it by 1.72 times adult dose. You get the dose of that what? Child. Is it clear? Is it clear? Any confusion? Is it clear? So the major thing is for you to understand that this scale, there's one you see, you may have up to 4 scale. But the most important thing is that it has 3 scales. The first one is height, followed by the surface area, followed by the what? Weight. So if you are giving, if a child enters your pharmacy now where you work, and you want to know the dose of a drug for that child, just take the weight of the child. In some pharmacies that don't know what they're doing, that's a scale you can use to check height. You take the height of that child, take the weight of the child, get your nomogram, place your ruler, cross it, you get the BSA of that child.
So this scale is a 2 or?
Yes. A nomogram is a 2. Yes. It is a table that is used to determine the body surface area. So with this, once you cross it, you get the body surface area of that child. Put it in that formula, divide that by 1.72, times that by the adult dose. You get the dose for that what? Child. This is the most accurate dosing for child for pediatric use, at least for now. And when square other one will come out, these things can come out over the years. It was all young through. After some time, say no, there's need for way to put it into consideration. Then they see to class through. After that, they say no, that isn't enough. You should also consider the person's height, because 2 people may be of the same age, but one's height may be. And as your height is, the higher your height, your body surface area is increased. It's not true. So you cannot, even though they have the same age, people can still have the same weight, but one is possible. One may be rounded on the floor, even though yes, that people with long bone tends to have higher weight, but still, it's still possible that one can still be taller. The other one will still have more weight than the other one. One can be taller and lanky.
Yes, like in football. They normally weigh around 17 kg.
Any question? So we can trace a nomogram. We can use the nomogram to determine body surface area. I enjoy asking this in exam. I don't joke with it.
So we are going to get the nomogram.
Don't worry. That one is not your business. It's not your issue. Huh? Yeah, of course now. All right, now, so this is how to calculate the calculation I told you that we will do in age, weight, and what. So let's do some calculation and see how far we have gone. There's a question here. The question says, see how the question. You use that nomogram. Is there any metric rule here? Nobody came with. You can use your pen, cross it over your phone, and trace this. Let's see what it will give us. That one I pointed out. Send it in the WhatsApp group. That image, send it in the WhatsApp group so that those that have the data can open it and use it to solve this question I want to give us now. A patient, okay. See, the question says patient, height 20 inches, weight 5 pounds, dose 75 milligram per meter squared. We are now told to find A. What is the patient what? BSA. B. What is the milligram per what? Dose. The question says patient height 20 inches, weight 5 pounds, dose 75 milligram per meter squared. The question now says calculate the patient's what? BSA. Then the second part says calculate the milligram per dose. That is how many milligrams to be delivered per dose. It's simple. All you need to do, you just zoom this thing a bit, zoom it a bit, zoom it a bit, then check, look at the height scale. Is there 20 inches there? Look at height scale. Is there 20 inches there?
Yes.
Remember that this thing is dual.
Yes.
Valentina, how far? You don't have the data? Child. You want to go? Huh? Bentanko? You don't have data? Now, please, each time you come to my class, ensure you have data because there are a lot of things I may tell you to look up. So you can always follow in the class. Now, it's only one person that's tracing this thing now. Can you transfer it to them? Is there any other means you can transfer it to them? Do it fast, without that data. No power here. Huh? Even in hostel, they didn't put you in the hostel. Why? Send it fast. Let's use it to solve this question. So I believe that after solving this question, you can solve any questions you are given. Okay. Are you done? Why not stay together so you can trace it together? Brenton, you and Victor, come close. Come close so you can trace it together. All right. You don't want to come closer. Okay. Okay. Are you done? Why is it taking time?
Maybe he has done that's 1990s and.
Or use if it's wasting time, you can use Bluetooth sharp. I think Bluetooth is even for food. Has it gone?
Yeah.
Good. Oh yeah. Now, so what you do is this: open it, check if there is 20 inches on the height scale. Is that 20? Remember that that is dual scaled.
No, this one is here. This one.
Good. Is 20 inches? Is there?
Yes.
Okay. Check the height. Check the weight side in pound. Is there 5 pounds there?
Okay, 5.
Is there 5 pounds there?
Yes.
Is that 5 pounds there? Yes. So now, use your pen. Use your pen. Let's just...
Here is 5.
Use your pen. Careful. Where is 5?
5
Good. 20 inches. Yes. You can, even though this may not give us accurate results, but let's just work on it. Is there something that can help us? Better. Good. Thank you very much. Now, if you place this metric rule now, we'll target 20. Hold that place tight. Let it be fixed at 20. Go down a bit, Jerry. Wait. It's now fixed at 20, right? Yes. Hold it tight so I can move to that end. I will now move this end to 5, right? Just hold it to what? 5. Bring that end down a bit. Let it be at 20. Now, look at this surface area. You need to understand how the surface area is scaled before you can count. How is it scaled? We have
for child. Okay.
Yeah,
look at for SA.
Yes.
0.
Check the next calibration.
0.2.
0.2.
Yes.
So how many subdivisions are there? 2, 3, 4, 5, 6, 7, 8, 9, 10, right? So 0.2 minus 0.1 is what? 0.1, right?
0.2 minus 0.1
is
yes.
Then divided by 10. 0.01, right?
Yes.
So each of this subdivision is 0.01, right? 0.01. Right? So now here is 0.1. So this is 0.11. Is it clear now? 0.12, 0.13, 0.14, 0.15, 0.16, 0.17, 0.18.
Yes.
Is it clear? So the SA is what? So the SA of the surface area of the BSA of the child is what? 0.18 what? Meters squared. So all we need to do is we now use this thing. We have gotten the first answer. 0.18 meter what square. You are now asked to find the milligram. How many milligram that you should take in per dose? We are told that the dose is what? 75 milligram per meter square. Remember, this meter square is BSA. So that means if 1 meter square should require 75 what? Milligram, right? Therefore, 1 meter square should require what? The answer is what? Milligram. The dose is 75 milligram per meter squared. So 1 meter squared, a child that has 1 meter squared body BSA should require 75 what? Milligram of the what? Drug. A patient that has 1 meter squared, that's been of this, hope you know. A patient that has 1 meter squared body surface area will require what? 75 milligram of the what? Drug. So if a patient that has 1 meter squared BSA requires 75 milligram of the drug, we will trace here to be what? 0.18. So 0.18 meter squared will require what? X. You make X the certain formula, you cross multiply. X is now what? 0.18 meter squared times what? 75 milligram over what? 1 meter squared. Meter squared will cancel meter squared. 0.18 times 75 is what? 13.5. Huh? Is it? You are looking confused. Is it? Good. 13.5 milligram. So the patient requires 13.5 milligram per dose. Good morning. So the patient requires 13.5 what? Milligram per dose. 13.5 what? Milligram per dose. Any question here? So you can trace nomogram perfectly, right? Good. You can trace nomogram. It's easy to trace. You know, this before you can trace nomogram, there are two things. There are things to consider. Anytime you are giving nomogram, check the height and know whether the height. Check the height scale and know whether the height you are giving is in the scale. That's first thing you check. The second one is that ensure that the weight is also in the what? Scale. Once you are sure of this thing, then you start your tracing. In our last class, I told you something about geriatric patients, right? That you should consider that there are a lot of organs are now because of old age, they are getting weak. So you should adjust the what? Dose. Am I completing? Please read this material. It's easy to understand. I have said almost everything there in our previous class. So please go through it.
So for this long table about BSA, so we are going to
Cram
that BSA for 81 percent 6 kg. This is the BSA 1.9. That means because that's one concerning age, weight, and height is better compared to this last one. It's very, very low.
what are you talking about? Let me understand what they're saying. Okay, you're talking about the height, that last table.
That last table is much.
So you don't have to cram that, Okay. No. You cannot cram it now. This is what you, but that's how you use it to do your calculation frequently. It will enter your system. But if you are given question, you must be given. These things we are calculated using this formula. This is you see here we are calculated using. If you like, we can trace one here. No.
Using the height and.
Don't worry. Look at this now. Here, look at this place. You are told that a child has Let's try it because we are science inclined. So there are some things you will told. You trace it yourself. Now, see what to do now. You are given body weight now here, right? You can pick any body weight. Pick the corresponding BSA. Then pick the height of that correspond to this body weight. Am I completing now? There's a table that shows height and body weight. We will just keep a blind eye on this BSA. And we will trace this body weight. Check here height that corresponds to this body weight. Use that body weight and this height to check whether you use nomogram to check whether it will give us the BSA attached to that body weight. So now go pick any height. Go to pick any body weight here. Pick any body weight that you can trace on this nomogram. You can pick any body weight of your choice. 14 kg, right?
96 height.
No, check the height. Height is what?
96 cm.
96 what? cm. Check the height.
Okay. 14 kg. 96 cm.
Write it down. Now go back to that last table. What?
BSA is 0.62.
Excuse. Hello? Sorry for this. Okay. Have you gotten it? No, see what I want you to do. Okay, you trace BSA to what? 0.62. Are you sure of this?
Yes.
Can you see 96 cm in the height scale? Huh?
Yes, but
Good.
it's very small.
Where is it?
CM.
96 cm.
90.
90.
This one, 200 is 1, 2, 3, 4, but you can't see it clearly.
No, well, we can trace it from here. Here is 10 again. So in between here, 1, 2, 3, 4, 5. So that means 10 divided by 5 is 2. So that means each of this big line, each of this is.
Sir, I told you this one is 1.
Okay, sorry, inches. Sorry.
This one is for CM.
Okay, CM. How many? Can't see whether you can count these tiny lines. No, it's something now. See where everything here and here is something. I'm working with this place.
You are working with
Yeah. Check here from here to here is 10. 110 minus 100 is 10. And there are 1, 2, 3, 4, 5. 10 divided by 5 is what? 2. So each is 2. We can trace it here. Look at it here now. This is 1, 2, 2, 4, 6. So 96 should be around here. This is 2, 2, 4, 6. 6 here. Put it there.
the black one.
Put it there. Yeah, put it there. Then trace 14 kg. Let's see what it gives us. At least it should give us something closer to that. Place it 96. And what? 14 kg. Where's kg?
Here.
Here is 10. Do you know the calibration first?
Yes.
What's the calibration? Is it 1 kg? This is 10.
I thought they used
5.
Yes.
1, 2, okay, 1 kg. So 14 should be here, right?
No, it's
14 should be here.
yes.
Then 3 seats. 0.6 what?
Correct.
Correct. It's not correct. 0.162. So human beings are lost. Chai. It's where?
I don't know where it is.
Victor, after you teach them, I can go back again. Not only Victor. Who else that have been here since that didn't understand what we are trying to test? You know, Victor was like trying to find out. You know, I told you that all those tables we are seeing yesterday, we are calculated using this nomogram. They were calculated, that thing you are seeing, they were calculated using what? Nomogram. That if you understand nomogram, forget, you don't have business without those tables. You can do it on your own and prepare your own table on your own. You can list, wait. Get the corresponding height, and get your what? BSA by yourself. They were prepared using what? Nomogram. So we proved one now. There's a place he saw in the table, 14 kilogram. And they told, and they said that the 14 kilogram correspond to height of 96 cm. Then BSA of 0.62. So we now traced it by ourselves to know whether it will give us that 0.62 they claim. So we used that height and the weight. It gave us 0.62. Am I communicating? So that's why I say that that table was prepared using nomogram, simple. Okay. Now, I was saying something about geriatric patients. I told you something about geriatric patients in our last lecture that I've explained everything there, so no need wasting our time there again. I told you that as even if you don't fall sick, even if you are healthy, as you are getting older, 70, 80, 90, the organs will be getting weaker. Kidney is one of them too. Liver. So to avoid creating problem for such patients, you adjust the dose of the drug you give to what? the patient. So that's what this area is talking about. He said, geriatric medicine is a field of medicine that encompasses the management of illness or disability in the elderly. A major consideration in the dosing of elderly patients is kidney function, because reduced kidney function results in reduced drug elimination. True or false? Good. Increased drug accumulation. Once drug is not eliminated, it will do what? Accumulates. Increased drug accumulation and possible toxic drug level. True or false? When kidney cannot eliminate, it will accumulate, and toxic effect will do what? Increase. Am I communicating? Toxic effect and adverse effect. Listen carefully. Similar to the pediatric patient, renal clearance is extremely important when using specific drug in what? Elderly what? Population. So I think I have explained this before. When I said two extremes, geriatric patients and pediatric patients are two extremes. You should be careful while dosing their what? Drugs. So there's what's called, you do dosage adjustment. Most times it is halved. They divide it into two for such patients. So this is where we draw a curtain for pediatric patients. We are seeing in pathology, but we want to talk about drips. We want to talk about drip rates. You know that the drip infusions you administer to a patient, there should be a particular rate at which it enters to avoid causing what? Trouble. Mm-hmm. That's your line. Which I can do. All right, let's go now. Let's look at it. So after drip rates, we call it a day. We are done with what? Posology. We'll then go over to the seventh topic, which is what? Reduction and enlargement of what? Formulas. Now let's drip rates. Let's talk about drip rates. This thing has a lot to do with intravenous IVs, infusions. Am I communicating? Intravenous what? So when you talk about these parenterals or intravenous infusions, there are two categories. We have large volume what? We have large volume parenterals and what? Small volume what? You know what parenterals are now, right? Good. We have large volume parenterals. We have small volume abbreviation. This one is abbreviated LPV. LVP. This one is SVP. Have you heard of injection piggybacks? Piggybacks. Don't worry, we'll get there. Now, what are large volume parenterals and what are small volume parenterals? Large volume parenterals contain more than 250 ml. Any infusion or any parenteral that contains more than 250 ml volume is a large volume what? Parenteral. So your normal saline, 500 ml, is large volume. True or false? You are name them, dextrose water, 500 ml. So far it's above 250. It's a large volume what? Parenteral. While small volume parenteral contains 100 ml or less. So 50% dextrose water, is it large volume or small volume? 50% dextrose water. Why is it small? Well, why do you say small?
50% is signaling strength.
See, large volume perennial and small, they are not classified based on their strength. Though. It's based on the volume. So what is the volume of the 50% day source water we see in the market today? What is the volume? Can you see even general especially general?
So I didn't take that, but there are many bars here.
Can you even general? Actually, when you went there, so no pharmacists help you out.
So that was a waste of time.
No, don't talk like that. You know, you just started it. It's a good thing.
No, the unit we went to.
After this now, next one now, I get all from what flaws. And these are the flaws I'm pointing out.
Yes.
In the next one now, these flaws will be taken care of. And there's something we call we have what is called you need to be supervised. You need somebody that should be there. Preceptor. You need a preceptor that will be there with you, guiding you, showing you all those things.
Sometimes this HIV ward, that's the only place that
It's alright.
But sometimes lecturer March came and was asking us questions.
Like we that works in the.
Don't worry. Next one will be better. Don't worry. Next one will be better off.
We did not even conclude.
It depends the people on duty.
It's okay. Now, this 50% distilled water comes in 100 ml. 50% distilled water comes in what? 100 ml. So it's a small volume what? It's a small volume parenteral. True of us? It comes in 100 ml. While 5% distilled water comes in 500 ml, mainly 500 ml. Normal saline comes in 1 liter and 500 ml. Distilled saline 500 ml. These are the ones I've seen. Now, so you now know the difference between large volume parenterals. Yeah.
Can you mix normal saline and dextrose water together?
Can you use what?
Can you mix it together?
Mix it. I don't understand what you mean mixing it.
Like after giving the patient normal saline, we still come back and still give the patient dextrose water.
It depends on what you want to achieve. It all depends on what you want to achieve. Am I communicating? And what the choice of the one to give depends on what the doctor notices in the patient.
Because when we went to assess analysis, the doctor looks at the folder, normal saline 1 liter, this shows this thing.
No, yes. You see, but to what I'm saying, it depends on what you want to achieve.
And he wrote 4 hours. Normal saline. Then he wrote the other one. 2 hours.
After Nka.
The nurse was like, she put the normal, the dextrose first.
She put the distance first. Is that what the doctor told her to do?
That's what he wanted to do.
That's how they have issues. If a doctor writes something and you think the patient belongs to both of you and you think what he wrote is not in order, you before he changes, contact him because he must have his reasons to doing it. That's one mistake most people make in the healthcare team. It's wrong for a doctor to prescribe something. You go and change it without letting him know. It's a wrong practice. Two of you must align, agree on it, because you don't know his reasons for doing that thing he did. Even if it's a mistake, let him admit no, that's a mistake first. Don't assume it's a mistake. Except maybe the fact that there's no. The point is that I still bother to what I'm saying. It depends on what the doctor saw in the patient. That determines which one is right? Am I communicating?
There's that thing that normally used to put children on shoes. What is that name called? The other one is like ruler.
Like what?
One thing like a ruler. They normally used to put all these babies on shoes. They don't use this shoe.
It is snap it.
The thing is blue and white. Blue and white is in color. They used to have 5 mil, 10 mil, this, that.
Are you talking about 5 mil?
Like, they used to do like ruler. Things like ruler. They used to put children from inside. I saw it in Africa and emergency.
Is this scarf you're talking about? I'm confused. The only two things they use there, either scarf vein or what was it, cannula. This is one. Sit down. Come and sit down. Sit down. Let me tell you something again. I want you to be doing. If you go to a place, you are seeing something you don't know about, then what is your phone for? Snap it up with your phone. This is important. I didn't even you snapped it now. All I know is that once it's about administering infusion or injection for baby, either they use scalp vein or they use what? Cannula. But your description now doesn't even fit into any of them. So I'm even more confused now. You know what?
Next time you see it, snap it.
You can still go there today and snap it now. Victor, where did you snap that scale you gave me? You sent me. Huh? Okay, so you paid, okay. You can still go there today. Check it. I don't think they will chase you away.
Yeah.
Snap it. Let me know what I'm talking about. Is either a scalp vein or cannula. That's the only thing I know they can use for. Even adults, some they'll come to hospital. They'll just fix it in their hand. Some even go home with it. Come to that. It's cannula. They go home like that. Let's continue, please, so we don't waste our time. Now, do you know why this drip rate is important? A patient is lying down. The patient is lying down on the bed, and you set up a line, drip line. You set a line. Are you going to the content of the infusion bag, will it enter the system at once? At what rate do you need to administer it? Does it need to enter the system to achieve what you want, without causing any problem to the patient? So this is why this rate is very what? Important. The rate at which it enters the system is very, very important. And when they go slow, they just, of course, most of the infusion enters slowly. Even on normal injection, there's one you give as bolus, right? There's one you give as slow, especially when it is entering the what? Be careful about it. Am I communicating?
Yes.
Now, let's continue. Now, I asked you a question before. I said, have you come across the word piggybacks? Injection or intravenous piggybacks. Have you come across it? Across this word? Now, have you ever seen a patient, or have you ever been a patient in a hospital? They are giving sort of like a infusion, normal intravenous fluid. They get something like metronidazole infusion, and that's how they will attach it to the normal line they have already set for you, for the patient. The metronidazole will now enter through the same the same
Inside the water.
they enter through the same route and enter the patient's body. Have you ever seen something like that? Anything you attached as a small parenteral, as a small volume parenteral to a large volume infusion that is all that normal saline or whatever, and it's already entering a system. If you follow the same drip set to enter the system, that's a piggyback. So we call it intravenous piggyback. Piggy. Let me back it. Piggyback. The main line SAT is carrying that one in the back. That's where the name came from. Intravenous what? Piggyback. And I'm saying that most intravenous piggyback come as small volume what? Parenterals. Am I communicating? Most intravenous what? Piggyback come as small volume what? Parenterals. And they are given over 30 to 60 what? Minutes. They are given over what? 30 to 60 what? Minutes. Flagyl injection or infusion as they call it. Think that's how many mil? 50. Is it up to 200, 300 mil? Most of them are other 100. So that's why I said that most of the injection piggyback come as what? Small volume what? Parenterals. Let's continue. Now, while large volume parenterals for continuous intravenous administration are hung, of course, as I think I have explained that a patient is lying down, they will hang it. Now, can I ask a question? Why is it that the thing has to be hung? You hang it at elevated distance compared to the level of the lying down. Who can tell me the reason?
So that you receive the weight.
Okay. To do what?
So that gravity can help you to flow.
Good. So that gravity can help you to do what? Flow. Am I communicating? Because you have created a difference of height, right? A height difference. So you have created a potential so that you can flow from higher to what? Lower. Is it clear? Good. Now let's continue. I think I've mentioned that most this infusion need to be given with what? Slowly into the what? Vein, right? I've thought about that one. Okay. So both the large and small volume parenterals allow intravenous solution to be infused at a constant rate. At a constant what? Rate. They allow both of them allow the infusion to enter the system at a constant what? Oga fast, oga slow. You must maintain a constant what? Rate. A constant what? Rate. Now, in other case, the physician determines infusion rate in terms of mils per meter. There's something I want us to. These things that can be confusing. Let me write them out. There are different rates at which you can determine You can talk of mils per what? Minutes. This is a rate, different rate terms. Mils per minute. You can talk of drops per what? Minute. You can talk of amount of drugs. This amount of drug can be milligram, can be units. What did we say about units in our last two class? What is about units as a measure of amount of drug? What type of drug do they normally use units for? Biologically active molecules, right? Good. Something like vitamins, hormones, and what are you, right? Good. It's either milligram, units, milligrams, unit, the milli equivalent. Milli equivalent is used for the amount for electrolytes. Please note this point. This is our amount, but this is weight. This is for what? Biologically what? Biological what? Active distinct. Then this one, milli equivalent, is for electrolytes, like potassium ion amount, calcium ion, all those electrolytes, sodium ion, chloride ion, that are measured in milli what? Equivalent. That's the amount for them. Why unit is for like vitamins, hormones, even Camora is a unit. It's not true. Who has seen Camora before? Is Camora a biologically active? Yeah. Yes, it's from chymotrypsin, right?
Yes.
And it's an enzyme. Is chymotrypsin an enzyme?
Yes.
Is it an enzyme? So these things, check, and I will tell you, check whether it's an enzyme or not. Tell me. You'll be telling me now. Check whether it's an enzyme. Chymotrypsin. Chymora, content of chymora, the active ingredient in this brand name, chymora. Check the active ingredient. Imalo chymotrypsin ko imalo enzyme ko imalo enzyme. They are not conventional active ingredients you see, like paracetamol, all those active ingredients. They are special. They are under biologically active what? Substances. And I told you that you can never get, their purification is not that easy. That's why they are measured in what? Units. Now, so this amount per hour. So these are different rate stems we're coming across in these drip rates, different rate stems. Ml per minute. How many ml that is delivered per what? They enter the system per minute. How many drops per minute? And the amount of actual amount of blood that enters the system per hour. So let's forget these long stories. Let's pick the most important point here. The most important point I want you to note here is that what will help us to calculate drip rate. Of course, now from this now I've talked about that you can define drip rates, true of us, and the rate at which what happens. So from what I've been saying is now, if you ask to define drip rates, how do you define it? The rate at which what happens? Enter the system. So the amount of drug that enters the intravenously into the system per unit time. True of us. The amount of volume that enters. If you say amount, it can be volume. This is the volume that enters. That's why I said that this is the different terms for what? Drip rate. You can define as the volume that enters per given times, a minute. Usually the drops that enters. This is what amount that enters. Am I communicating? Huh? Okay. So it's an enzyme preparation, right? So it's an enzyme, right? Clap for yourself. You learn that one now, right? Yes. Good. Please, you have what it takes to reach out to the whole world. Your phone is not for TikTok. It's for this important point. Grab it once and for all. Real time. Don't keep it tomorrow. That's why I like my students to always have data. Real time is boost. We now feel boost. Because you have other things to learn after this class. You have grabbed this one. Next year, next 4 years, next 5 years, anywhere you see yourself, if they mention chemotherapy, you say it's an enzyme. How? Because you speak with what authority, because you know it's an what enzyme. So that's why it's measured in what units. Is it measured in units or it's unit, whether it's IU or it's units? Because it's a biologically active. The same thing with vitamins, name them, hormones, even insulin is also in units, IU, right? Many of them are here. But mean equivalent is for what? Electrolyte, like potassium chloride, potassium ion, chloride ion. I think I've mentioned this. So these things are different terms you use to define drip rate. You can define drip rate in terms of volume that enters per minute. You can define drip rate in terms of drop that enters. But this drop per minute, okay, yes, is rate. You can define it with respect to drop that enters per minute. You can define this in terms of the actual amount of drug that enters per what? Hour. Am I complicated? So these are different terms used to define. So you can define drip rate in using any of these terms. So I cannot come in and start defining drip rate for you. We are not in primary school. So all you need to do is understand what I mean explained. You can define it on your own, in your own words, factoring in any of these things. So it's easy, right? Good, let's continue. Now, there are important things you need to note while doing calculation on what? Drip rates. The first one is what? The right amount of drug that is to be given over time. Before you can do calculations on drip rate well, you must know first the right amount of drug that is to be given over time. You should know the amount of drug that is to be given over what? Time. It is very important. If you don't know the amount of drug, how will you talk of drip rates? It don't make any sense. Now you are playing. You just play. You must know the what? 253. Then the second thing you should know is that you should know the amount of drug needed to last a certain time. Let's assume you should to say, okay, by 1 hour, we would have delivered such amount of what? Drug in the system. You should to say that maybe in 30 minutes, and that's why sometimes we just give the solution to the nurse. In 2 hours time, give this one. Because they know that so far this rate is maintained, within 1 hour, this would have finished. After like 1 hour, give this one. So you must, before you can successfully deliver drip, set line properly and achieve your result, you should to know the amount of drug that should deliver within a specified number of hours or minutes, as the case may be. So you should to know that one. Then you should also be able to know the amount of time left until the IV is empty. The amount of time left until the IV is what? Empty. So that's when you can beat your chest and say that I'm very sure that this one, this thing, this IV, that nothing will remain in this what? Bag. Diffusion by the day. So these are important things you should note while calculating drip rate. Before we enter into calculation, there is something, hey, 919 nako. Wow. And I have it by 9,000. No, not so evil. Hey, guess when I please, I'll stop here because I'll stop here, please. If I come in our next class, we'll continue from where we stopped.
Are you coming tomorrow? Online?
Yes, I'll come tomorrow. I'll this how we'll come in until if we go for your break. Then is it what?
Only general meeting don't do these students waiting the border also hosted. What is that?
All right, so see you next time.